This is an audio-visual representation of a study published in the Journal of Bone and Joint Surgery in 2025. Studies have shown that patients with open fractures often experience surgical delays in lower and middle-income countries, or LMICs, which can lead to increased morbidity and mortality. However, the impact of surgical delays on patients with closed fractures in LMICs remains poorly understood. To address this gap, orthopedic researchers from the United States assessed the impact of surgical delays on the risk of infections in patients with closed fractures in LMICs. They analyzed the association between surgical delays and infections in patients treated with intramedullary nailing for closed diaphyseal femoral and tibial fractures aged 16 and above identified from the Surgical Implant Generation Network surgical database. A total of 9,477 fractures were included, of which 58% were femoral and 42% were tibial fractures. The researchers found that the mean delay to surgery in the study population was 10.5 days, and the median was 6 days. They also found that the overall infection rate in the study population was 3.1%. They highlighted that the odds of the patients developing infections increased by 9.2% each week of surgical delay. Additionally, the researchers observed that longer surgical delays were correlated with extended surgery durations and a higher likelihood of requiring open reduction, both of which may contribute to poorer outcomes. Given that surgical delays increase the risk of infections in patients with closed fractures, this study underscores the importance of timely surgical care for patients with closed fractures in LMICs.